patient's room, I first want to perform hand hygiene for a minimum of 20 seconds and also don the appropriate PPE equipment. For contact protection, that includes a gown and gloves. For droplet precautions, you want to use either goggles or a shield. And then for airborne precautions, you want to use an N95 respirator mask. Then you want to draw the curtain to provide privacy for the patient. Good morning, Mr. Patient. My name is Eva. I'm going to be your nurse today. May I please have your name and your date of birth? And do you know where you are today? And what is the year, please? I've determined that the patient is awake, alert, and oriented ×3. And Mr. Patient, do you have any medical histories I should be aware of? How about allergies? Are you currently taking any medications, prescription, over the counter, or herbal? And do you smoke, drink alcohol, or take any other recreational drugs? Now, how is your exercise routine? Do you have any exercises that you do on a regular basis? And how do you feel about your health overall? Do you feel pretty good? Do you have any complications or conditions that you would like to share? Okay, so great. So what we're going to do today, we're going to do a general health assessment from head to toe, just to see how your body is overall. And do you have any pain or tenderness I should be aware of anywhere on your body? No? Okay, so let's proceed. So first we're going to do the head and neck assessment. I first want to do the Perla test, which is we want to check for pupils are equal and round and reactive to light and accommodation. We want to use a pen light, and what we expect in this test, we want to see a direct constriction with the eye when the pen light comes to the eye, and we want to see consensual constriction on the other eye. To test for accommodation, you'll have the patient look in a distance, dilate the pupils, and then bring the pen towards their face, constricting the eyeballs once again as a normal finding. You want to also check the sclera on the patient. Sclera should be nice and bright and white, and then the conjunctiva should be nice and pink underneath the eye, and you want to gently pull down the skin. Mr. Patient, please say ah. On the inside of the throat, we want to check for the mucous membranes, which should be nice and moist and pink on the inside of the mouth. And for checking for carotid arteries and the trachea should be located midline, nice and straight in the middle of the neck. For carotid arteries, we want to make sure we palpate only one side at a time to not occlude oxygen to get into the patient's brain. And to check for cranial nerve 9, we're going to have the patient look to the left, look to the right, do the same thing with resistance for my hands, and then shrug their shoulders without resistance, and then also with my hands on the shoulders with resistance. They should be able to make those movements with or without the resistance of my hands. Now moving on to the respiratory assessment, we first want to check for transverse diameter. We want the diameter of the right to left area of the chest to be twice as wide as the front to back area. We don't want to see a barrel shape of the chest, which would be an abnormal finding. Then we also want to check the color of the skin, which should be congruent with the patient's ethnicity. And we want to see the general breathing pattern of the patient. Are they having labored breathing? Are they using any accessory muscles? Or are they breathing nice and evenly and without any extra movements? We want to check for respiratory rate, which should be 12 to 20 respirations per minute, and also the oxygen saturation rate by using a pulse oximeter, and the results should be 95% saturation at room air. Now to palpate, we want to look for symmetrical chest expansion. I want to place both of my hands on the back of the patient's back, lower back right here. They're going to take a deep breath, and my hands should expand equally on both sides of the chest. For tactile firmness, I'm going to put my hands in the back of the back on the top, and the patient's going to repeat the phrase 99, 99, 99 as I am touching the patient's back. I should feel an equal vibration on both sides of the back. For percussion, I want to start at the apices of the lungs, which are on the top. I'm going to percuss and listen for resonance, resonance, resonance. I want to do a patterned movement left to right and going down underneath the clavicles. Underneath the scapula. I want to move a little bit more laterally on each side of the back. In this area, you also want to check for diaphragmatic excursion. So you're going to have excursion, which we're testing for the effectiveness of the diaphragm. The patient takes a deep breath and exhales. I'm gonna palpate for resonance. When I get to a dull sound, I'm gonna mark it with a pen. Then the patient's going to take a couple more breaths, take a deep breath and hold. I'll do the same motion, and when I hear a dull sound, mark with the pen again. The distance between those two markings should be 3 to 5 centimeters at the most as a normal sounding. To auscultate for breaths, for lung sounds, there are 3 different areas. Now I'm gonna use a stethoscope. The first area is along the trachea. We're looking for bronchial sounds. And here we're gonna listen on each side of the throat with the diaphragm of the stethoscope here. We're gonna expect the expirations to be longer than the inspirations. Second sound is the bronchiovesicular sound of the lungs. We're gonna do that on each side of the spinal column, here, going in a systematic manner like this. And the expirations and the inhalations are gonna be equal in this location. And the final sound are vesicular, which are on the perimeter of the lungs. You wanna look at on the lung periphery here with your stethoscope. You wanna also make sure you're looking at, you're listening to the side of the body and underneath the armpit. Now, an additional test you can do in the back of the lungs is to test for consolidation. One of those tests is the egophony test. I'm going to have the patient repeat the letter E, 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 as I'm listening for breath sounds, E, 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 E. A normal finding is to hear a muffled E letter. If you hear a clear A letter, that is an abnormal finding for this particular test. Now, moving on to cardiac assessment, the patient's going to be lying down in bed at about a 30-degree angle. And I want to start with the jugular vein distension test. I'm going to be using 2 rulers for this test. One of the placements for the ruler will be at the angle of Lewis, which is right on the sternum. And then I'm going to be looking for the jugular vein where the highest distension is along the neck area. I'm going to join those rulers together. If the distance between the 2 rulers is 3 centimeters or less, that's a normal finding. If it is more than that, you want to do a secondary test, which is the hepatojugular reflex test. You want to go ahead and press on the liver very gently on the abdominal area, push upwards. That will cause the excess blood to go through the jugular vein and cause the distension. A normal finding is once you release the pressure, the jugular vein should once again get flat. If it's still distended, that's an abnormal finding. We also want to palpate the pericardium. We're going to be doing the chest wall sweep, moving from one side of the chest to the other. And here we're feeling for lifts and thrills. Lifts are a sign of displacement, and thrills are just some sort of unusual vibrations that you're feeling on the chest. To auscultate for cardiac sounds, first you can use diaphragm and also a bell for these assessments. First, I can use the bell to listen to the carotid artery. I'm going to be placing it on the side of the neck, and here we're listening for bruits, which could be a sign of turbulent blood flow through the carotid artery. To hear the heart sounds, we want to start at the angle of Lewis, move directly to the right at the second intercostal space, which is going to be the aortic heart sound. That is a S2 sound. Directly across the sternum is going to be the pulmonary sound, which is also S2. Moving down 1 into the third intercostal space is the tricuspid, which is S1 sound. And down at the medioclavicular level between the 5th and 6th intercostal space is the apex of the heart, which is the S1 sound. And that is our mitral sound, and that is the most loud and the point of maximum impulse, because that is the apex of the heart. Now, S1 means that is the start of systole. S2 is the end of systole and the beginning of diastole, and these are known as the love doves. Now, moving on to abdominal assessment, patient's going to be laying flat. First, we want to inspect the general shape of the stomach. Is it flat? Is it round? If there is a scaphoid or protuberant shape, that is an abnormal finding, so you want to investigate a little bit further. First, on the stomach, you want to go ahead and auscultate. You're going to be dividing the stomach in imaginary 4 quadrants, starting at the right lower quadrant because that's where the ileocecal valve is, and that's the beginning of peristalsis. You are listening for sounds up to 5 minutes per quadrant. You need to listen for 5 minutes to determine there is no sound. 5 to 30 sounds per minute is normal. Less than 5 minutes is hypoactive bowel sound, and more than 30 per minute is a hyperactive bowel sound. Now palpating on the abdominal area. Mr. Patient, are you feeling any pain or tenderness on the abdominal area? No? Good. Okay, you want to ask that first. And then you want to use both slight and deep palpations on the stomach, starting with the slight about 1 to 3 centimeters deep. If there's no pain, you can go further between 5 and 8 centimeters. You're feeling for hernias, organs, any sort of tumors, bumps, anything unusual in the abdominal area. And then percussion is done last, as to not disturb the bowels when you're doing the other assessments. You're going to use your fingertips. The normal sound you're going to be listening for is tympani, 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 going in a star-shaped pattern all over the stomach area. And if you hear any dull sounds, usually that's the sound of an organ because it's dense. You can do one test for ascites if you suspect fluid buildup in the abdominal area. One test is the fluid wave test. The patient will put their arm like this in the center of the stomach. You're going to gently press the side of the abdomen, and you're going to actually see a wave of fluid going into the abdomen from one side to the other. Now moving on to the upper extremities assessment. First, you're going to be inspecting the general skin of the patient. Once again, looking for it to be congruent with the patient's ethnicity. You're looking for any bruising, lesions, swelling, edema, any unusual changes in the skin. Using the back of my hand, I'm going to test for temperature. The skin should feel dry and warm. You want to check the finger for capillary refill, squeezing it, letting it blanch and return color. Checking for clubbing. If the angle of the nail bed is more than 160 degrees, that could be a sign of low oxygen levels. It could be a sign of more serious respiratory or cardiovascular diseases in the patient. Check for radial pulse on the wrist. Checking for brachial pulse on the medial aspect of the elbow fold. The elbow, we can check for crepitus or signs of arthritis. That's a good joint to check it at. To check for range of motion, we have extension, we have flexion, we have supination and pronation. Now moving on to the lower extremities, once again we want to assess for color. We also want to check for abdominal hair growth. If there's a lack of hair naturally on the skin and you also see a shiny skin, that could be actually a sign of peripheral vascular disease, so you want to look for those indicators. You want to check for bruising, lesions, swelling, edema, same thing on the legs. Checking on the tibia is a good place to check for edema. If you just press down on the tibia and there's an indentation that stays, that could be a sure sign of edema. You want to check for the feet and the nail beds. Are they yellow? Are they cracked? The bottom of the foot is very important to check, especially on diabetes patients, because they start to lose sensation in the periphery, and a lot of times they can have lesions start to form on the bottom of the foot and they're not even aware of it. Checking for pulses on the feet, we have pedal pulse on the top between the large toe and the second toe, and the tibial pulse is located on the medial aspect of the foot behind the malleolus. We want to check for range of motion on the feet as well. We have plantar flexion, which is a pointy ballerina. Dorsiflexion, we have a 90-degree angle. Then we're turning laterally, which is inversion. The whole foot is turning with the pinky towards pointing towards the floor. And eversion is a medial turning of the foot with the toe pointing towards the floor. We want to do a regular walking gait test and the heel to toe test, where the heel is touching the front of the foot like this for the patient. We want to make sure that we're watching the patient so they don't wobble or they're at risk of falling. And we're watching the general gait. Are they able to stay in a general straight line when they're walking? Checking for genital urinary. Mr. Patient, how often do you urinate in a day? And then what is the color of the urine? Is there any odor? Do you have any itching or burning or incontinence ever. Urine should be clear or light yellow, there should be no odor, and you should have a regular pattern every day when you go to the restroom. The final thing with an assessment, it's a good learning opportunity depending on the assessment results or the age of the patient or the gender of the patient. One assessment I chose for my patient is to do a self-breast exam. Mr. Patient, the best time to do this exam is at the end of your menses, at the end of your period, because that's when you have the least amount of inflammation on your breasts. You want to do it in a warm shower. You can put lotion or soap on the breast tissue. That makes it easier to slide your hands over the breast tissue. You want to make sure that you palpate the entire area, looking for lumps, bumps, any unusual texture. You want to make sure that you remember the tail of Spence, which is an extension of the breast tissue, as well as the axillary area, making sure you palpate for the lymph nodes underneath the arm. Now, before I leave the patient's room, I want to perform hand hygiene once again, and thank you very much.